Hello, everyone, and thank you for taking the time to join me today for this educational webinar. My name is Dr. Todd Strong. I'm the founder of the Strong Health Institute. I am a doctorate of chiropractic as well as a board certified chiropractic neurologist. I'm also a certified functional medicine doctor as well as a practitioner of applied kinesiology. I am also a member of the Kalish Institute, which is a functional medicine learning facility where a lot of functional medicine practitioners come together and we work together on certain patients, developing clinical protocols and discussing lab findings and how best to serve our patients. So today what I want to do is I want to talk to you a little bit about the clinical model here and how it works and why we have such good success. And we don't treat or diagnose any diseases, but what we do is when we focus on your health, most of the time we find that your health issues go away. So in today's world, we're all stressed out. We all have kind of like emotional turmoil going on, especially right now with the COVID crisis. And today I just want to talk to you about how that influences your daily functioning and what we can do to correct that. So let's go ahead and get started. So basically we have three body systems that make up health. And so we have hormones. So that includes progesterone, testosterone, estrogen. That also includes thyroid hormones. That includes hormones such as cortisol. So there are a lot of hormones that dictate your overall health. And a lot of these hormones are dictated by your GI system. So you can see down in the bottom left-hand side, so your gastrointestinal system. A lot of that has to do with cortisol will actually is your stress hormone, and if it's too high, then what happens is cortisol will actually deplete your stomach lining, so then you'll start getting digestive issues. You won't be able to absorb vitamins and minerals that make neurotransmitters. That leads to chronic depression, anxiety, these feelings of self-doubt. So it's kind of like a whole cascade that becomes an issue and ends up turning into these long-term issues we see further on down the road. And now why does that happen? Well, because cortisol, what it does is it really places a big demand on your body because I have to either fight the tiger or get away from it. So when this happens, you need as many amino acids, proteins, and carbohydrates, fats, whatever it is, to fuel your body to prepare for that stressful event. And if you're lacking or you're depleted in those, or if you're in a chronic stressful state, then what happens is cortisol will actually deplete your gut lining because it has glutamine in it, which is a vital, essential amino acid that you need to conduct these processes. So that's how chronic stress will eventually end up affecting your GI system. And then on the bottom right-hand side, you can see the detoxification system. This includes the liver. Now, the liver is where you do a lot of your detoxification, whether it's bacteria, viruses, whether it's due to environmental exposure to toxins, whether it's due to medications. It could be due to the foods that you're eating. And if this becomes overburdened, then what happens is that you actually sacrifice the transformation of your hormones to actually take on the detoxification process. A lot of your biotransformation of your hormones, especially the thyroid hormone. So let's just take, for example, 60% of your metabolically inactive T4 gets converted to T3 in the liver. Now, if you have a toxic overload, what's going to happen is that you're actually going to sacrifice that function in order to detoxify more because you've got so many toxins in your body. And what does that lead to? That leads to these thyroid issues that you see a lot of people complaining about. And just giving them a thyroid medication or supplement never really fixes the problem. And then you have them on this long-term thyroid medication, but the underlying root cause of detoxifying the body is still there. So we see this really commonly. And then you see people develop long-term hormonal issues such as estrogen, testosterone, progesterone issues because the biotransformation of the hormones happens in the liver. So that is something that we look at, detoxifying your body. Just a little quick fact, since World War II, there have been 80,000 new chemicals released into the environment. And studies are showing now that people today have 40 to 50 chemical toxins in them compared to before the World War II era. And now they're also finding that these toxins are crossing the placenta, which they thought didn't happen before. So a lot of these kids now are exposed to environmental toxins from a very young age. And one of the things that we can kind of speculate on is we're seeing rises in autistic spectrum disorders. We're seeing rises of ADD, ADHD. We're seeing rises in just behavioral issues in general. We see a lot of those in my clinic, and we're able to successfully help those kids and give them more of a chronic long-term health and give them the ability to learn and focus and thrive. And now all of these are kind of connected. So it's kind of just this never-ending cycle that we go through. And it's kind of like, where do we start with this? And so if we look at this next slide, this is the healing model that we look at first and foremost. So let's go on the left side. So gluten-free. So one of the new studies is coming out that more and more people are susceptible to gluten. And why is that? Well, most of the time these are genetically modified products that we really don't know the complications that happen with ingesting those foods, and the immune system identifies them as a foreign invader, and then what it does, it causes autoimmune responses. So you'll see that happen a lot with people who have a lot of brain fog, because these gluteomorphins, which we'll discuss a little bit later, actually attack the brain, and they plaque onto the gut lining in the brain, and that causes the immune system to attack the gut and the brain. That can lead to issues such as brain fog, migraines, anxiety, depression, chronic long-term. You're probably looking at Alzheimer's, dementia. There's a gliadin is a certain gluten protein that will actually attack what's called your cerebellum, and the cerebellum is responsible for accuracy, balance, and coordination. So you'll actually see people who are unbalanced or uncoordinated, and they'll actually have a gluten sensitivity. The next one is blood sugar control. So making sure that your blood sugar is pretty stable throughout the day. So one of the things that we do is we give you a dietary guideline to follow, making sure you're eating in the morning, eating a snack, eating lunch, eating a snack, and then eating dinner. And making sure that you're eating the right things and not spiking your blood sugar and then you crash. So we all have that Thanksgiving dinner crash. And, I know, especially my family, they always were like, oh, well, it's the turkey that makes you sleepy. And it's actually not. So what actually makes you sleepy is that you ingest this huge amount of simple sugars and carbohydrates, and you get this spike in your blood sugar. And then what happens is that you get insulin secreted so much because you have this huge consumption of simple sugars that it actually tanks your blood sugar and causes you to crash. And that's what actually makes you feel lethargic and sleepy. The next thing is stress reduction. So making sure that we plan some stress reduction in your life, whether that's 5 minutes of journaling in the morning, 5 minutes of journaling in the afternoon. You could do meditation, making sure that you're just going for a walk for at least 30 minutes a day to kind of clear your head and get that out there. Go talk to a friend, go do something good for yourself. And that's very important, because today we're just constantly go, whether it's job, family, kids. So taking that time to bring those stress levels down will actually bring down your cortisol levels. And I'll show you this a little bit later, but that will actually help with these issues of anxiety, depression, the breakdown of your stomach lining because you're not secreting as much cortisol. So there's just a whole kind of plethora or a wide variety of issues that occur, and that we can simply use these stress reductions and incorporate them into our life and live a higher quality of life. The next one is sleep. So the studies about sleep are just, there's more and more studies coming out about how the benefits of sleep, being able to heal, getting restful sleep, and being able to track that. If you look at the market now, and they'll tell you kind of what the new trending topics are, and sleep is one of them, because you have all of these new apps and these devices that track your sleep, if you're getting into deep sleep, REM sleep, what's your quality of sleep, and tracking just how you feel. So sleep is vitally important. A little tip on that: make sure that you're getting into bed before 10 p.m. and that you wake up around 6 a.m. or a little bit after. So you want that 7 to 8 hours of sleep, making sure that you're not looking at blue light before you go to bed, making sure that you don't eat just a simple sugary meal that's going to keep you up, avoiding caffeine or any other types of stimulants. Exercise. This is something that we all definitely want to incorporate, especially for the weight loss component, because weight loss is that simple mathematical formula. You have to burn more calories than you're taking in. And, that gets harder, especially if you have some of these hormonal issues going on with increased cortisol, if your thyroid hormones are off, if your estrogen, progesterone, or testosterone hormones are off. So exercise is something that we definitely incorporate into the patient care model, and it really depends on where you're at, because somebody who is a stage 1 of adrenal fatigue is going to be do different exercise modalities than somebody who's at a stage 3 and just completely exhausted. And you'll find that a lot of times, especially in these high performers that are just go, go, go. And what they'll do is they'll exhaust themselves, and then what they'll do, they'll go exercise really hard, and they'll get that cortisol spike, and they'll feel really good, but then they end up crashing the next day because they don't have any nutrients, they don't have any of the resources to repair. Now, if we go over to the right side of the healing model, we've got the adrenal stress profile. Now, this is something, the very beginning point of where we start in the clinic. Most of the time we run an adrenocortex stress profile from Genova Diagnostics, which tells us about your cortisol levels, how they are throughout the day. And then it also tells us about your DHE levels, which we'll cover more in depth later. But basically what it is, it's a fatty acid that needs to make your estrogens and testosterones. So if you're depleted in that, then there's no way that you can produce those hormones. Now, with this, what it is, we send it to your house, you just spit in a tube 4 times a day, and that's it. And then you send it back to the lab, we get it back, we go over it with you, and that tells us whether you're in stage 1, 2, or 3. And the protocols are a little bit different depending on what stage you're in. So we always want to make sure that we're giving you the appropriate protocol for which stage you're in. Now, this affects female hormones directly, and we'll see in a chart later about how if you have what's called a pregnenolone steal, which is a precursor to your progesterone and cortisol, that most of the time you're going to be converting more of your pregnenolone to cortisol, and you're not going to be making any progesterone. And then also you're going to see that this is going to rob the pathway of testosterone and estrogen production, which just causes a whole cascade of issues. Now, leaky gut repair, that's basically step 2. And what we do is we look and see if you have any pathogens in your stomach, making sure that they're not causing any issues like chronic inflammation, any oxidative stress in the body, making sure that you're not leaking any proteins, bacteria, or viruses into your gut. Now, why do we do this? Because, like we mentioned earlier, cortisol actually robs you of glutamine in the stomach lining, and it causes your gut to leak. Now, I know that doesn't sound very good, does it? But what happens is you get all these materials leaking into your bloodstream that shouldn't be there. So what does this lead to? Well, this leads to chronic and systemic inflammation, and you wonder why people have rheumatoid arthritis, why you're feeling fatigued or groggy all day, you hurt all over, brain fog, you'll see migraines caused by this. So there are just a vast array of issues that occur because of this leaky gut syndrome. And our goal is to put you on some glutamine, give you some herbals, make sure that we get rid of any parasites, bacteria, or viruses hiding out in the stomach, and getting you that stomach sealed off so that you can absorb the vitamins and minerals and nutrients that you need to thrive. Enzymes and probiotics, we use these to come in and break down any kind of, I would say, like garbage in your stomach, and we help flush it out, because if you don't have the appropriate amount of digestive enzymes, whether it's from the stomach, the pancreas, or the gallbladder, then you're not going to be able to break down foods appropriately, and sometimes that'll get junked up. That's what can cause constipation. That's what can cause like abdominal pain, gas, all these sorts of issues. And then probiotics. So once we've kind of got all the pathogens cleared out of your stomach, we've got it nice and sealed up, we're going to populate your stomach with the appropriate bacteria. And if you look, there's a lot of research coming out about your microbiome in your gut and how that affects how you think, how you act, how you feel. Now, a really fun fact. So serotonin, 90% of that is made in your gut. Now, what is that? That is your feel-good hormone. So 90% of that is made in your gut. If you have gut dysfunction, you could be missing up to 90% of your serotonin production. Now, what does that mean? You see a lot now, people are put on SSRIs, which are called selective serotonin reuptake inhibitors. And those are used to treat issues such as anxiety and depression. Well, if we look at this from a clinical standpoint, then what that means is that if we fix your gut, there's a high likelihood that we could help resolve your anxiety or depression issues. So now, without the use of medication. So you don't have to take this thing that's messing with your neurochemistry that's just causing who knows what. So that's something that I really like to help a lot of patients with in the clinic as well, is coming over those issues. But we have to repair your gut first. That's where we have to start. So we're at the point now, we've got your adrenals healed, we've got your cortisol, we've got some lifestyle changes, we've got the gut repaired, we've treated you with some enzymes, some probiotics to get that appropriate. Yeast overgrowth, we're looking for Candida albicans. Mostly that's common with thrush, with people who have like a white coated tongue or vaginal yeast infections. So that's something, if you have those commonly, then we want to make sure that we're using certain things like oregano oil or some herbals to kind of get rid of those. And we can always refer you out to a medical practitioner if we feel that there is the need, but most of the time we're pretty confident that we're able to help using alternative therapies for these. Then the last stage is the liver detox. So as we discussed earlier, the liver is where a lot of your detoxification pathways occur, but it's also where your biotransformation of hormones occurs. So that's your estrogens, progesterones, testosterones, and your thyroid hormone, and your thyroid specifically. And with an increase of thyroid cases happening everywhere, especially I see these in my clinic, is that the first thing we have to do is we have to get these adrenals fixed, we get your gut fixed, and then we detoxify you. And what happens then? Well, your body doesn't have to worry so much about clearing out all the environmental toxins, whether it's the medications or whether it's the inflammatory food that you're eating. So now it can really focus on producing the appropriate amount of thyroid hormone. And what does that look like? That looks like increased metabolism, weight loss. That looks to better changes in mood, feeling, energy. So that's kind of like our little process and how we go through the healing model and why it works and how we have to do it a specific way. Now, if we look at this is the easiest way that we can break this down for you. So the most common cause of health problems is usually precipitated by one of the following events: death, divorce, childbirth, usually the second or third, and overwork. So I think everybody can relate to these, unfortunately, in some way. Now, what that looks like, if we follow the arrow over, that leads to a stress hormone increase, which is cortisol, right? So cortisol, like we said, breaks down that stomach lining. It makes us use that stomach lining for glutamine so that we can carry out other metabolic processes. And decreased immune response. Now, why does it cause a decreased immune response? Well, your gut is also the location of 80% of your immune system. So what happens is, if you have a dysfunctional gut, one, you're not going to be producing serotonin as discussed earlier, and you're going to have a decreased immune response. So what causes this? GI pathogens can cause it. So Blastocystis hominis is one that we commonly see. Entamoeba, histolytica. There are just multiple ones that we look for in the test, and Genova does a really good job at finding these so that we can get rid of them. The food intolerances, so if you're food intolerant to gluten, dairy, soy, corn, sugar, nightshades, that's something that we look at cutting out, and we look at doing what's called an elimination diet to figure out which one it is. And we look at cutting that out so that you're not causing systemic inflammation, so you don't have brain fog. Now, does that mean that you can never eat these foods again? Probably not. There's probably at some point once you get detoxified so much that you're able to handle those. Now, can you go eat a whole tub of Ben and Jerry's? I would not advise it if you're lactose intolerant or you have a gluten sensitivity, because you're probably going to have diarrhea for the next couple of days. But if you want to enjoy a cup of ice cream, but you understand that you're maybe a little bit inflamed the next day, have a little bit of brain fog, it's really just depending up to you. But what we want to do is we want to give you the tools to understand why you're having these issues, so you don't freak out, causing more stress, causing your stomach lining to break down, causing you to become depressed or anxious, and you can kind of see how that goes. And then, like we said, in the GI, making sure that we heal up the leaky gut, making sure that you don't get that systemic inflammation. And the thing that worries me about that is the development of chronic diseases such as heart disease, such as rheumatoid arthritis, autoimmune issues, multiple sclerosis, just a whole vast array of chronic illnesses that I believe, if you apply these principles, then you're going to be able to live a really good, long, high quality life. And then, so as we can see this, as we go from the GI, this leads to increased toxins throughout the body, and this just makes our liver and detox system overwhelmed. And so then we start sacrificing other processes such as the biotransformation of hormones, leading to those thyroid issues, weight gain, depression, fatigue, and pretty much just everything that kind of plagues most people today. Okay. And then, so how do we correct these? So you can see we do stress management. So like we said, just instilling periods in your day where you're taking some time for yourself. The Pomodoro method, if you're not familiar with that, that's where you work for 25 minutes, then you take a 5-minute break, then you work 25 minutes, and then you take an extended break for 10 to 15 minutes, and then you just repeat that throughout your work day. And that seems to work really well for my patients, and also to kind of give you that mental break that you need to help reduce that stress. That could be journaling in the morning, taking some time for yourself in the morning to just enjoy without an electronic device, just writing down your thoughts and your feelings, talking to a loved one, whatever it may be. Meditation is also a really good one that we suggest. The research behind meditation is just phenomenal. And then a healing diet, we always put you on a healing diet, making sure that we cut out the most common food intolerances in your diet, making sure that we're getting rid of those, and making sure that we're giving you the best chances to reduce the inflammation, to reduce the stress on your body, so that you can carry out these more important tasks and to function more optimally. Spiritual and emotional, a lot of what is going on today definitely places a lot of emotional stress, the divorce rates, whether you've had a death in the family, whether it's your job, your kids. So, those can cause a lot of emotional turmoil, and just addressing those and coming up with strategies to really effectively address them before they become something overwhelming. Exercise, we have some recommendation guidelines, especially depending on where you're at and how stressed you are, for what types of exercise you should be doing, and just how to incorporate them into your lifestyle. And sleep, we've talked about that as well, making sure that you're getting the appropriate amount of sleep so that you can rest and recover. Most of the time we do nutrient replacements, such as amino acids. Amino acids are the building blocks of everything in your body, from your hair cells to your muscle cells to neurotransmitters to your toenails. So pretty much everything in your body is made up of an amino acids, and not only you see a lot of time branched chain amino acids, but essential amino acids. Essential amino acids are basically the minimum what you need to carry out every process in your body. So if you don't have all the essential amino acids, it's kind of like trying to build, let's say you're trying to make cars, and you have 100 windshields, you have 100 trunk doors, you have 100 axles, but you only have one steering wheel, you can only make one car. So that's essentially how amino acids work, is that if you don't have the appropriate amount, then you're not going to be able to make the appropriate amount of neurotransmitters, muscle, whatever it is, to really fuel your life. Essential fatty acids, these are anti-inflammatories. These are more of what you're going to see in like your fish oils. Fish oil is probably one of my number one supplement recommendations that I have, just for its anti-inflammatory processes. And it's also what makes up 70% of your brain, the DHA, sorry, in fish oils is what makes up 70% of your brain, so just cognitive function as well. And then minerals, looking at your B vitamins, your zincs, your chromiums, that's something that we talk about a little bit in depth, and you'll see it in these metabolic pathways and how it ties in. So the first thing is we correct the adrenal, female hormones, and the thyroid. Most of the time when we resolve the adrenal issue, we find that female hormones and the thyroid take care of themselves. There are some cases where we have to dive in a little bit deeper, but for the most part, we find that resolving your adrenal issues helps resolve all three. And then the next stage is we work on the gastrointestinal system, so treating your leaky gut, making sure that we're getting rid of any parasites, bacteria, or yeast in your gut, and then putting you on probiotics to get the right amount and the right type of microbiome or microflora in the intestinal tract. Then the next thing is the detox. So just making sure we're supporting the liver cells and the detox pathways, making sure that we're getting rid of any heavy metals, and that is more common than you would think, especially with dental fillings, job, environmental exposure to those, depending on where you work and what you do. That's something that we also have to take into consideration. And then this stands for SigA. It stands for secretory immunoglobulin A. What a mouthful. And it's a mucous membrane surface antibody that produces immunocytes in the mucous membranes. Now, what does this look like? Well, this is primarily in your intestinal tract, so the mucous membrane there that goes all the way up to your mouth, and also in your nasal and sinuses. Now, most of us have allergies or some sorts of a runny nose at some point throughout the year. And that's basically what this is talking about, is you're looking at inflammation of those mucous membranes in a reaction to or the release of secretory immunoglobulin A. And that causes these allergic type responses, that causes inflammation. And what happens is that if you are secreting so much cortisol that you're breaking down the mucous membrane, you actually deplete your SigA response, and you're actually not able to handle those allergic reactions and those inflammatory responses. So just as it says here in the second bullet point, SigA provides the first physical barrier of defense protecting against pathogens, so parasites, bacteria, and yeast. So let's play this from a story point. So let's say that you're very stressed out, whether it's from job, work, stress, not eating good food, just other inflammatory responses. Then what happens is that you're going to decrease your mucous membranes due to the secretion of cortisol. Now, what does this lead to? So you have decreased mucous membrane surface antibody production, and then you're more susceptible to these parasites, bacteria, and yeast, which cause these chronic long-term infections. Right? So I hope that kind of makes sense of how that works. So SigA values will be high in GI problems in the early stages and low in chronic GI conditions. Now, this is why we like to run this GI panel, because we like to see, are you in the early stages or are you in the chronic stages? And our treatment varies depending on what stage you're at, because it may take a little bit longer if you've had this more long term, or it may resolve fairly quickly if we've caught it early. Gluten intolerance, as we talked about before, a genetic autoimmune disorder that destroys mucous membrane tissue and creates an overly permeable GI tract. So just talking about how this leads to leaky gut. Now what they're finding is that if you have a leaky gut, most of the time you have a leaky brain. So you're getting brain inflammation from an immune cascade occurring in the cranial vault that leads to migraines, that leads to brain fog. It can lead to, memory issues, ADD, all these issues that just kind of go on cognitively that are really scary, and we're finding more and more about them. So underdiagnosed condition, I would say that there's more of this today than we really realize, and there are certain ethnic groups that are more prone to these conditions, and just with cultural diversity and how everything, there are more integrations of ethnicities, and then that just leads to a widespread, more susceptibility to these gluten intolerances. So it's common in those with alcohol and food related disorders. Symptoms of gluten sensitivity include unexplained fatigue, weight gain, digestive problems, and depression. Recent research shows 1 in 33 Americans have celiac disease, which is an autoimmune issue where gluten actually attaches to the stomach lining, and then your immune system comes and attacks that and causes an inflamed bowel. The most extreme manifestation of gluten intolerance, so that's the celiac disease is the most extreme manifestation. And I would probably argue that there are more than 1 in 33 Americans. I would say that, it's probably more like 1 in 20, if not lower. Personal history and family history reveals the likelihood of gluten intolerance. So most of the time, if someone in your family has it, there's a high chance that somebody else or your whole family is going to have it. And then 3 contributing factors. So in order to be gluten intolerant, a patient must have the gene for gluten intolerance: English, Irish, Scandinavian, Scottish, Eastern European, most commonly. And I would say that that's, quite the majority of people have some, connection to one of these ethnicities. And then sufficient gluten in the diet. If you're going and you're eating pizza pockets every night, and you're eating a sandwich for breakfast, lunch, and dinner, and you're exposing yourself to all these gluten-laden foods, and you kind of wonder why so many products now say gluten-free, and it's kind of like, here's your sign, right? Because they're telling you that it's becoming more and more of an issue, and they're wanting to avoid these lawsuits that come with people having these severe reactions to gluten. So you can definitely see how this is becoming a big issue. And even though, because the food industry is so big and these gluten chemicals or these gluten additives to food are so prevalent, they can't just stop production, but now they've got to give a warning. Triggers such as physical trauma, severe emotional stress, surgery, and infection will also play a part. And so, you could have ate gluten as you were a kid, and then you had one of these physical traumas, an emotional stress, surgery, or infection. And now, because that lowers your threshold for how much you can handle, then you become gluten intolerant because you were probably able to fight it off before, but now you're not, and now you're more sensitive to it. The chemistry of addiction, so looking at gluteomorphins, they are morphine-like compounds from the breakdown of gluten. These chemicals trigger a feel-good reaction in the brain and create addiction to the very foods patients are sensitive to. This is why we often crave the foods to which we are most sensitive. And then why does this happen? Well, most of these food companies have been doing research on, what gets the customer hooked and what keeps you coming back to buy their products. And adding gluten, adding sugar, those are the biggest two, act on these opioid receptors in the brain, and they get you addicted to it. It's kind of like anything with like nicotine. It acts on certain receptors in the brain, kind of gives you a little bit of a dopamine response, and then you just want more and more of that. But the long-term effects of that, even though it may give you a short-term gain of happiness, then what is the consequences of that later? Well, you're probably going to feel depressed. You're probably going to have brain inflammation, brain fog. You're not going to be able to go throughout your day and function as well. So a healing diet, this is basically one of the things that we incorporate into our patients. and lifestyle. And it's a diet high in protein, non-starchy vegetables, and healthy fats that controls insulin and glucagon levels. Food allergies and gluten intolerance can create tissue damage in the intestines, so that just leads further to the leaky gut issue. So we want to cut all of the most common food allergies and intolerances out. Following a food rotation diet and eliminating gluten and dairy can relieve many symptoms. So just making sure that you're rotating your foods pretty often, trying out new things, noting down what is actually causing issues and what isn't, because we want to make sure that we're getting rid of those, whether it's a nightshade, whether it's the dairy, whether it's gluten. We want to make sure that we can identify those triggers and then avoid them at all possible. So here's the healing diet guidelines. So eliminate gluten, soy, pasteurized dairy, sugar, and hydrogenated oils. Eliminate alcohol, coffee, soda, and NSAIDs. Foods to include, organic if possible, are protein, beef, pork, lamb, no more than once per week, fish, poultry, eggs, nuts, and cheese, vegetables, fruits, gluten-free grains such as amaranth, buckwheat, and rice, beans, potatoes, sweet potatoes, yams, fats, butter, coconut oil, olive, flax, sesame oil, and then avoid canola. Now, just to be clear, some of these foods, and I'm just going to mention a few, such as eggs and nuts, sometimes those can be food intolerances, and we have to be very careful about how much we're eating of those and making sure that we are limiting those. A lot of the times what I like to do is cut those out for the first 3 weeks, and then you can add them back in and see if you're starting to notice that your signs or symptoms are coming back, if you're having any discomfort, brain fog, anything like that. And then we can also see it with beans as well, beans and potatoes. So that's another thing. Once you start adding those in, then we need to make sure that you're still feeling well, you're not having any severe issues with those, not getting an inflammatory response. But for the most general part, as long as you prepare those foods appropriately, you shouldn't have any issues. Then definitely a gluten-free diet, so no wheat, rye, barley allowed. Most people who are gluten sensitive notice improvement in the first 60 to 90 days. When combined with rotation diet leads to best clinical outcomes. That's what we've seen, and then the functional medicine realm has seen in clinical practice. Safe grains are rice, corn, millet, buckwheat, quinoa, and amaranth. So corn, if it's organic, I would not eat GMO produced corn because corn will actually it actually binds to vitamin B3, which is called niacin. And what it does, niacin is a precursor to your testosterone pathways or hormone pathways. If you're eating a vast amount of corn, and we see corn in everything, corn syrup, corn starch, high fructose corn syrup, you definitely want to avoid those products with the more refined and processed corn. But like I said, if you're getting corn from the Amish or it's organic, it's probably not as bad. But you really want to be aware of that. And if you're not getting better and you do notice that you're ingesting more corn products, to cut those out. Oats are usually tolerated, but I just had a patient the other day that said that they ate oats and it just caused a bunch of issues. So making sure that you're getting gluten-free oats if you eat them, or just cutting them out completely. Dairy-free diet, I've found this to be a big one. I actually had a patient who had multiple sclerosis, and she would just fall down and she couldn't get back up. She had been to a neurologist, been suffering with this for multiple years, and thought she was just going to have to live with it forever, and didn't really understand what was going on. Basically, all we did was we did an elimination diet. She cut out all of these triggers that are very common food intolerances. And what we found was that when she would add dairy back in, or milk chocolate or anything like that, that she would actually start to fall down again. Now, what does that mean for her? It means that she has to be very careful about adding any or consuming any dairy products, because there is the issue that she could fall, and that is very scary, especially if she was out by herself or if she was driving, any one of those issues. So we want to make sure that you really are strict about this and really keeping a good track of what you're eating. So this is avoid milk, cream, cheese, ice cream, cow's milk, yogurt. I know what most of y'all are thinking. That's all the good stuff. But like we said, we have to do this for a certain amount of time. And does it mean that you can't ever have this again? No, it doesn't. But until your symptoms resolve and you get to where you're feeling better, we absolutely have to cut these out. Because once we get you better and we get your body detoxified, you can handle a cup of ice cream. You can handle an ice cream cone. But you're just so inflamed and overburdened right now that your system can't handle it. And it's just making the cascade even further and further every time you're eating ice cream or cheese or one of these dairy products. Some may tolerate unpasteurized or raw dairy or heavy cream. So that's something, to you make sure that you're getting it from a good resource and that it's not something that was processed inappropriately that could have bacteria or anything like that. Butter, ghee, goat's, or sheep's milk, cheese, or yogurt are usually well tolerated. So that means cheese or yogurt that is produced by goat's or sheep's milk is normally well tolerated. So causes of hormonal imbalance, emotional stress. So like we said, just taking time to kind of go through, apply some de-stress or some stressful kind of like ridding techniques at some point in your day just to bring that emotional stress level down. Dietary stress. So basically, the reason we do dietary is if we bring that stress level down on your body, then you can handle more emotional stress, which we all tend to deal with more. And then pain and hidden inflammation, and that is inflammation in the GI system, chronic systemic inflammation throughout the body. Types of stress. So the number one is mental or emotional. How we perceive an event rather than the event itself is most important in generating a stress response. So essentially, it's like if you're driving down the highway and somebody comes up and they're blaring their horn at you at 90 miles an hour, and then they go around you and flip you the bird, that creates a pretty stressful event, right? And I did a lot of my doctorate training in Atlanta, so that was just constant stressful event every day for 45 minutes that it took me to go 5 miles. So that was super stressful, and just being able to get home and kind of de-stress from that was just kind of like the best thing that I could do. But you're constantly bombarded by that today. Whether you're going out, you're going to the grocery store, whether you're online and you see something happening, social media, the news. My number one recommendation is stop watching the news, because you're constantly getting cortisol spikes and it is just wrecking your gut. So just a little tip, stop watching the news. It's one of the most stressful events that happens that I have found causes a lot of depression and anxiety in my clinic. Imbalanced blood sugar control. So simple carbohydrate ingestion leads to rapid elevations in blood sugar, which ultimately leads to up and down dysregulation via insulin and cortisol responses. So just eating those simple kind of comfort foods, those simple carbohydrate meals, wrecking your blood sugar, those just cause a cascade of issues. So, we put you on the diet, and the thing that's easy to do, change your mindset about healthy food. Don't think that food is awful. If you can think like a good strawberry or a good watermelon or, a nice organic burger or, some sweet potato fries, like those foods are delicious, and you just need to change your mindset about how you think about food. And that's something that we can help you with as well. Pain and hidden inflammation. These are cascades that occur due to most commonly the first two. And you'll have chronic systemic inflammation, people who are diagnosed with arthritis. Arthritis is, in my opinion, kind of like we don't know what's going on, so we're just going to call it arthritis, when basically you have systemic inflammation due to ingestion of inflammatory foods or emotional stress going on. Now, I know this is a lot, but I'm just going to explain something really, really simple, okay? So I've done all the hard work for you to understand how this works, so you just trust Dr. Strong and I'll get you through it. So stress, we have psychological, so basically, just your thoughts, kind of like what's going on in your life, traumatic, if you have a fall or, you have a car accident, anything that's physical. Electromagnetic. Now, this is more, I know some people are like, ooh, woo, woo, but it's actually studied, and there are a lot more consequences to this than most people think, because x-rays actually, you can actually see where photons go through you and they cause a chemical or cellular reaction. So the electromagnetic realm is actually something that is actually very powerful. Now, if you've actually looked at your iPhone or any Bluetooth device, you will see that there's a disclaimer that using this device and holding it up to your head, it emits radiation, and there is a warning for cancer. Now, you probably didn't know that, because if you're like most people today, you're just like, yeah, I understand, sign your name, and then you're good to go. But if you really look at it, why are they putting these labels on these products? Well, most likely because they're trying to CYA, right? They're trying to cover their butts so that they don't get sued. So basically, with any product that you use, look at what the labels are saying and the warnings, because they'll tell you if they're stressing your body out. So, and that's something that you're exposed to every day, all day long, just like food. Infectious, bacterial or viral infections. Allergic is if you're allergic to the foods that you eat, any food intolerances. Dysbiotic is any issues with the gut, so if you have bacteria, parasites, or viral. And xenobiotic is more like any outside sources, like medications, environmental toxins, those sorts of things. So all of those kind of influence. And now you're probably thinking like, oh man, Dr. Strong, like, how am I going to live? Well, that's the thing, is that you do these little simple protocols that we set out for you. You just incorporate all these factors into your lifestyle, and then we're just going to basically give you the tools that you need. So none of this stuff is ever going to matter, because you're going to be so healthy and you're going to have such a good immune system, and you're going to have all the nutrients and vitamins that you need to produce the appropriate neurotransmitters to support your immune system, to give you the highest quality of life long term, so that you don't develop these chronic diseases that are just rampant, such as heart disease, such as diabetes, such as Alzheimer's, such as Parkinson's. And the reason I'm doing this is because I hate seeing those patients come into my clinic, because they're already at that point. And the premise behind my care and why I got into this is preventative care, so that I can prevent you from getting to that state. Now, talking about that, it's a lot of education. There's a lot of things that have to go behind it. And, it's not an easy road. It's not a simple medication that you're just given and everything goes away. It is a process, and we do work with you and give you the support that you need to get through it. So I digress. But if we look here, let's go down to the bottom left. You have your adrenal cortex and medulla. This secretes your glucocorticoids, your catecholamines, epinephrine, norepinephrine, aldosterone. Now, let's just go to glucocorticoids, because that's the one that we're focused on. Cortisol, if we follow that little line where it says inhibition in the middle and then it goes to T3, you can see how if you're secreting cortisol, you inhibit T3, and that's the active form of your thyroid hormone. Now, why does that matter? T3 regulates your metabolism, so weight gain, weight loss. It regulates your energy production. You'll see, in autoimmune issues where people have thyroid issues, just all these symptoms occur where they have increased weight gain, they're lethargic, they have fatigue, they have hormonal issues. So that's why it's super important, and that's just where we're going to stick. That's all you need to know. If we fix your cortisol levels, then we can fix your thyroid issues, and then it fixes this whole cascade. So you've got better feedback loops to your brain, the hypothalamus, and all these kind of precursors to these diseases or these stressors or these symptoms that you're having. So once we fix that, most of the time you can handle almost any stress that you come into, which is really cool. Now, pregnenolone still, this is a big one. Now, if you look at this pathway, you can see how you need vitamin B5 and cholesterol gets converted to what's called pregnenolone, and then pregnenolone gets converted to progesterone. Progesterone eventually ends up at cortisol. Now, what happens is you're super stressed out, you're going to take all your pregnenolone and you're going to convert it to progesterone, and then you're going to convert it to cortisol. So what happens is you don't produce any progesterone because it's all going to cortisol. And you can see if you're taking pregnenolone and converting it down that pathway, now you can see where all these other little hormones are kind of like, they're not as sharp and they're not highlighted, but you can see testosterone and estradiol, those are your two sex hormones. You don't make those whatsoever. So no wonder why you have hormonal issues, increased weight gain, you have low libido, you're fatigued, you're lethargic, okay? Now, DHEA, so you see where it says, and under the little red X where it says dehydroepiandrosterone, that is DHEA. That's a fatty acid that we use. And what we do in the meantime while we're healing you is we supplement you with that so that you can make the appropriate amounts of testosterone and estrogen so that you can function while we're doing these stress relief techniques for cortisol. And then we also give you pregnenolone so that when you are stressed out that you do have the appropriate amount to convert to progesterone if you need to, and then also cortisol and support the pathway while you're just a little bit more stressed out. And then here's just another chart that you can see how pregnenolone gets converted to progesterone, gets converted to cortisol and cortisone. And so you can see how if you're just converting all of it, you're really stressed out all the time, you don't have the appropriate lifestyle or mechanisms to handle that, then you're just really going to suffer producing your progesterone to producing your estrogens and your testosterones. This is the intestinal villi. So this is what your gut looks like. And so you can see it's supposed to look like these little kind of like finger-like projections, and these are what absorb all the vitamins and minerals in your intestinal tract. Now, if we go to the next slide, you'll see that advanced malabsorption. So more people today have nutrition and vitamin deficiencies than anywhere in the world. In the United States, it's really common. Now, why is that? Because even though we have just abundance of food, more food, it's just crazy how much we waste. But even though we have an abundance of food, it doesn't mean that we're eating the right amount of foods to get those. Because you could have all the food in the world, but if they're vitamin or mineral deficient, then it doesn't matter. You're still not absorbing those. You're still not getting the vitamins and minerals you need to make neurotransmitters, to make muscle cells, to make immune system. So that's why supplementation comes in. We use supplements to boost those up and make sure you're getting the appropriate amount if you're not getting them through dietary, because most people are running like Ferraris today. And if you don't have the gas to run the Ferrari, it doesn't matter, okay? Then you're just pushing the Ferrari, and that's not very cool at all, okay? You want to be able to take that thing and go from 0 to 60 in 3 seconds, right? So you need the fuel to be able to do that. And that's where nutritional supplementation comes in. That's where diet and lifestyle changes come in so that you have the ability to do that. And if we look here, you can see how just the atrophy of the intestinal lining from just chronic cortisol production occurs. So, realistic timeline. Like I said, today, it's not just a pill that you can take and you're going to get better. Most of the time, you're going to end up developing a chronic disease unless something happens. So basically, what we do is we do a consultation. We get you on a gluten-free and anti-inflammatory diet for at least 60 to 90 days. We like to run these 3 lab tests: an adrenal test, it's all saliva; stool test. Yes, you do have to collect a stool sample, but that's it. You send it in and we get the results. And then organic acids test. That basically tells us about inflammatory markers in your body and what we need to do to basically bring those down. So basically what we do is we start with the adrenal test. Once we get the results back in, then we can say, hey, look, here is where you're at. And then this is kind of like the supplement protocol, the dietary protocol that we can do to help reduce those cortisol levels. And if we need to replenish with DHEA, then we can, because it'll also tell us about your DHEA levels. So then we get your hormones boosted back up. We bring your cortisol levels down with some adaptogenic herbs, some vitamin C, a few other products that work really well. And the research is just phenomenal about how they work. Once we're pretty confident we've got the adrenals and got you on that program, we do the stool test. So we see if you have any pathogens. We treat those pathogens. We'll treat the first one. If you have one, if you have two, then we'll treat one, the most severe one, then we'll treat the second one. And then we'll retest and make sure that we've got rid of it. Most of the time we use like oregano or some other herbals to kind of help get rid of the pathogens that are going on there. Or you can use like St. John's wort or wormwood, those kinds of herbals to get rid. Making sure that you don't have any candida, definitely getting rid of that. And then basically what it looks like is after we've got that done, then we detoxify you, making sure that we got any heavy metals, making sure that we're getting the gut repaired and nutrient replacement, making sure that you've got the nutrients and vitamins that you need to run like that Ferrari that you want to. And then we just retest, make sure that everything is doing really well. We make sure that your symptoms are going away, that you're feeling better, that you're just ready to go live the best life ever. Okay? Now, this is kind of what it looks like, and these are months, okay? So it's not anything, but you do have the support from us and my staff to give you the best care that we can, because we want to fix people. We're not just trying to band-aid people. We're trying to give people the tools that they can go and live a healthy lifestyle and implement this into your kids and give them the best future, because the more and more that I've seen kids, the more and more I realize the need that they need the education about how to live healthy and how to take care of themselves. And it all starts with the parents. So parents, it's like if you start adapting these and you start feeling better, the kids are instantly going to feel better. Now, this is just kind of a little addition I threw in here. This is a review of the normal menstrual cycle. So this is something that will happen as you kind of go throughout the ovulation cycle. So you can see just, let's go up here. So blood levels of the follicle stimulating hormone. And then, so you can see it gets, that's your luteinizing hormone is the pink line. And that gets secreted at, that's like around the like right before the ovulation phase. So making sure that that's appropriate. Then let's go down to blood levels of estrogen. You can see how it's pretty stable, and then as you're getting ready for ovulation, the blood levels of estrogen should go up, and then they come back down, and then they're pretty level throughout the luteal phase of your menstrual cycle. But that's when your progesterone levels should shoot up, kind of like when you're around that day 14 of your cycle. And then you can see the bottom one just kind of shows menstruation. That's kind of like how the uterine lining is kind of swelling up and preparing. So, that's something that will be really affected too if, like we said, you're secreting that cortisol and you're not making the appropriate amount of estrogen, testosterone, and progesterone. Like you're really going to suffer in this ovulation cycle. And, people who have a trouble getting pregnant or any of those issues, that's kind of why, because you're so stressed out, because your body can't support another human being because it's so busy dealing with its own issues, if that makes sense. Oh, let me go back real fast. And then female hormone imbalances. So these are just some common issues that you see: fat, fatigue, depressed, chocolate cravings, food addiction, food dependency, compulsive overeating, bread or carbohydrate cravings, low sex drive, cry easily, mood swings, PMS, hot flashes, night sweats, insomnia, irritability, sweet cravings, bloating, weight gain, sometimes without changes in diet and with increased exercise, alcohol use, wine daily to relax, cramping, irrational thoughts, axe and husband's head syndrome, which we definitely don't want that, okay? So yeah, that is not advice. That is something that we can definitely help with. Anxiety, wake at night between 2 and 4 a.m., dry skin, hair loss, poor bladder control, osteoporosis, that's a big one, unfortunately, in the elderly population, fluid retention, breast cancer, heart disease, gas, infertility, irregular cycles, poor reactions to estrogen. So you can kind of see, like, are we saying that all of these will go away? No, but will they significantly be reduced? Of course, that's the goal. So it gives you the ability to handle these issues a lot more appropriately, and they may go all the way. We see issues all the time that some patients just have complete resolution. and once we get everything kind of balanced, it's not an overnight thing. It does take some time, but we do have really good success, and that's why functional medicine is coming out and about so much. So I hope you found this webinar and this informational guide very informative. If you want to come work with me, then you're more than happy to. I do free 15-minute consultations that we can kind of talk about, and I can tell you whether that I think that I can help or not. And we're going to give you the tools that you need to succeed in your health and create just the lifestyle that you want to live. Health is basically the foundation of everything else in your life. Because if you're not healthy, then it's like you can't enjoy time with your family. You can't enjoy time doing the things that you want. You can't use your money the way you want, because what does it matter if you're so arthritic or you've got so much inflammation in your body that you can't go and enjoy the things that you do? So there are just a lot of basic concepts here that we use to help get you to where you need to go. And education, I feel, is the best way to do that. So that's the point of this lecture, and the point of my job is to educate you and give you the tools that you need to survive, and then help you if there is anything that is kind of holding you back. Okay, so again, I hope you enjoyed this, and I look forward to hearing any feedback that you have about the lecture, and you all have a great day. Bye-bye.